Hello, this is Dr. Mike Morris with Chittenden Dental, and I just wanted to show you a piece of technology we use with all our patients here. This is an iTero scan, a 3D scan of a patient's teeth and bite. And this is just showing how much we can kind of use this information to help diagnose and to help with patients' goals. For example, this patient has a difficult time with hygiene because of the crowding here. And this patient also is wanting to try to improve their bite and to really try to get a bite that's functional as well as aesthetic that will last a long time without issues. So let's start off and just go through. With this monochromatic view, we can really see the detail in the teeth, and you can see how the teeth are actually worn, and you can see how there's recession. There's all this recession here. If you could see the comparison to these teeth here, this one has more recession. This tooth has some recession in the gums from uneven forces with the bite. Also, you can see how this tooth here is worn in the front. Up here, there's that big shelf of chipping and wear, where that tooth was actually shorter than its neighbor tooth. If you take a look, this tooth is actually moved as it's worn and chipped. It's erupted down. Another area, we call this abfraction, where the tooth here has actually been sort of worn away. It's like if you bend a green stick, it doesn't break, it kind of notches. And that's also from uneven wear and grinding and clenching. And there's a really cool feature where we can actually look at a patient's bite, and we can see with this what we call a heat map. It shows where the bite is the heaviest or the hottest, with red being touching and then blue being almost touching, and then if there's no color, no touching. So you can see that this patient doesn't even touch their 12 front teeth, and they have this really big, what we call an open bite or overbite, and they only really touch this one tooth back here, and it's very heavy in that one tooth. And now we can really see how all the front teeth don't touch, and we can start to understand why some of these back teeth have the recession and the wear and the issues. And this person, is trying to move their lower jaw to find a bite in the front and chipped and broke down these front teeth. And you can really see down here on the bottom how there's all this uneven wear and chipping and crowding. And this can all be resolved and this can all be treated to get a more aesthetic mouth that's easier to clean, and a bite that we would actually have even contacts all around that would then last the long term and still be healthy and still look and feel the same many years later. So I hope this was informative. Thanks for joining me for this Wellness Wednesday video of the iTero and how we can use this to help patients understand what's going on in their mouth and what we can do to help.